Ivermectin, does it work? Let's discuss the newest research. Hi, everybody. I'm Dr. David with another episode of Ask Dr. David. I was asked to comment on a recent publication in the New England Journal of Medicine on the early outpatient use of ivermectin, and we'll get to that in a little bit. Of course, as you know, ivermectin was one of the many repurposed medications that were looked at earlier in the pandemic to see if there would be a benefit to find something that's widely available, that's inexpensive, that may actually work in the treatment of for COVID-19. Now, I have had many patients over the year who have acquired ivermectin, and I would first off to say they have all gotten prescription strength from American pharmacy forms of ivermectin, and they have not, nobody that I know of has used the horse paste. And of course, that was one of the things that was a concern last year, was that people were getting this product that was also a horse dewormer from veterinary supply stores and people were taking much larger doses than what people have been recommending. Now, as you also may know, ivermectin is a very widely used medication around the world for parasites in humans as well. Now, some of my patients who did use it said that it was amazing, wonderful turnaround in the next 24 hours. I have a patient who actually wasn't able to start the immune protocol because she didn't have the supplements on there, told me it was a wonderful turnaround for her, told me that her mom had the same experience. I've also had a lot of patients who have told me it didn't do anything for them that they could tell. Now, this treatment, as you may also know, was first advocated by a group, called the Frontline COVID-19 Critical Care Alliance. And this was a group of emergency medicine and critical care doctors mostly, who very early on were just looking for anything that would help. And so lots of different medications, steroids have been tried, Luvox, which is fluvoxamine, a SSRI medication was tried, all types of things, hydroxychloroquine we had heard about. And so, but ivermectin is certainly one of the things that a lot of people continue to ask me questions about. So I thought it would be important for me to report on this newest research. So what I'm going to do here is I'm going to use my screen share here in order to, first of all, show you with this protocol that was being promoted by the Frontline COVID-19 Critical Care Workers, Critical Care Alliance, I should say. Now, I do want to point out that this was not an anti-vax group. You'll see here that they do encourage people to talk to their doctor about the role of vaccination as well as these protocols as well. So, of course, that's good that they wanted to have other doctors involved in the discussion and decision-making. You can see that they were not anti-maskers. They were encouraging people to wear masks. And, of course, we now know that cloth masks are pretty much worthless, and there's some benefit from surgical in terms of stopping the spread, and of course N95 and similar masks in terms of stopping a person from catching it for those high-risk people, especially in poorly ventilated, in terms of crowded spaces, etc. They were, of course, also encouraging social distancing, or physical distancing, as I like to call it, because we need to be more social, and of course hand washing as well. And you'll also see here that this was back in January of 22 when it was revised. So this was an updated protocol. Okay. Now, one of the things that you will see here in the antivirals is they were advocating for the use of 0.4 to 0.6 milligrams per kilogram per dose once a day. Now, the FDA approved dose for parasites in humans is 0.2 milligrams per kilogram per dose. So they were advocating for a higher dose. Pardon me. And so, of course, that also could have raised some questions because there was a higher dose than what was being recommended by the FDA for, as I said, for parasites. So this is kind of how they started off that. Now there have been a lot of studies that have looked at the use of ivermectin for COVID. Many of them have not been very good studies, okay? Some showed success, some did not. Now, I have supporters of ivermectin who have critiqued the studies that were done and have raised questions such as, well, they started it too late, they didn't use a big enough dose, that they didn't go long enough, etc. And those, of course, were things that people took into consideration, or at least wanted to discuss further, as maybe the right study wasn't done. Okay, so now I'm going to show you this actual study from the New England Journal of Medicine, of course, one of America's most prestigious medical journals, and about the effect of early treatment with ivermectin among patients with COVID-19. Again, early treatment. And I'm going to jump ahead here for a second to a comment that they made in the discussion, which I thought was rather interesting, where it says here, they began the trial, they randomly assigned patients to receive a 1-day dose of ivermectin, and as that's what was most commonly used for the parasites in humans. However, they did get a lot of feedback from people who were advocating for the use of ivermectin, and so they decided because of that they would actually change it to a 3-day, to giving the ivermectin for 3 days, and also at a higher dose. So in this study, they did use the 0.4 milligrams or 400 micrograms per kilogram instead of the standard 200 or 0.2, depending on how you do the math. So that was very nice because they did take into account some of the important concerns that people had raised. And so again, this is kind of a new type of research because it's looking at it from that perspective. Now, of course, let's see what they actually found. Okay, coming back to the forward, and this is where the abstract is. Now, one of the things is there was a total of 3,500 patients. Now, this is part of a larger study. This was done in 12 different clinics around in Brazil. And this was actually looking not just at ivermectin, but this group was also looking at a lot of those other repurposed types of medication like fluvoxamine, which is Luvox, steroids, etc. And so they had placebos that were kind of available for all of those different groups. And of those, 679 patients received ivermectin, 679 were placebo, and then the other 2,100 and change were people who got those other treatments that were out there. What they found was of the overall 100 patients who got ivermectin, had a primary outcome event. And let's talk about what that means. A primary composite outcome was a hospitalization due to COVID-19 within 28 days after randomization and starting either the placebo or the ivermectin at the dosing mentioned, or if they were in the emergency department for more than 6 hours. So this means they just weren't in and out, but they actually were under observation for a while, because you don't keep somebody in the emergency room for 6 hours unless you have a concern about their health and you're needing to observe them, their oxygen levels, making sure they're well hydrated, etc. Okay, so now what they found was, again, 16% of the patients in the placebo developed that level of hospitalization or ER, 14%, and that was not a significant difference in terms of from a statistical analysis. Okay, now of these 210, 171, 81% were hospitalized. So most of the people were actually needing to go into the hospital. Again, people who received both the placebo as well as those who received the ivermectin. Okay, now I am going to share some other stuff. I'm not going to go through this study completely with you, but there were a couple other really important points that came out in terms of the research. Number one, there were no significant differences between the ivermectin group and the placebo group when it came to the how soon the virus was cleared at 7 days, how many people had no more evidence of the virus at 7 days through swabbing. No, there was no difference in terms of the overall hospital stay, no difference in terms of time for clinical recovery where they were feeling significantly better, or death, or the number of days that people were ventilated. So basically, the placebo compared to the ivermectin, there was really nothing statistical that showed that there was a difference. Now, one thing that they did show was that there was no difference in terms of side effects in terms of people who took ivermectin versus people who took placebo. So at least in the asking of the question, is ivermectin at 400 micrograms per kilogram or 0.4 milligrams per kilogram, is that a dangerous dose to anybody? Is it a safe dose? It does appear to be a safe dose, but of course, we're not just looking for something that's safe. We're looking for something that's effective. And at least in this study, the evidence really did not show that to be so. Okay, so I'm going to come off of our screen share here and come back to here. Okay, very good. So in looking at this, and whenever a scientist looks at a medical study, research study, there are always questions like, well, what are the limitations of the study? There is no such thing as a perfect study. So there were a couple of things that I gathered when I was reading through this paper. Number one, fair question. Might there have been an outcome difference if 600 micrograms versus 400 micrograms are done? We don't know. Wasn't studied. Maybe someday somebody will study that. But at least in this higher dose of 400, there wasn't a difference. Might there have been a difference because what they did for the study is they started somebody within 7 days of symptoms. So they didn't go into a second week. They could have started sooner than 7 days, but they were excluded from it if they were sick for more than 7 days. Fair question could be, what would have happened if they wouldn't have accepted anybody who started within 3 days? Okay, that's a fair question as well. Also, because this was done in Brazil and only using a Brazilian population, it's fair to question, could other ethnicities, other types of other living in other locations, exposures, etc., have been different as well? And so we don't know. Now, of course, because of the fact, we can only look at the data that's put forth to us. And so that's what I'm reporting on. Okay. So what is my take on all of this? So number one, ivermectin is not a treatment that I'm actively recommending to my patients. Okay. I am certainly open to more quality research. I would look forward to if there is a 600 or one of the or other data. And again, I'm an open-minded person, as you know. I'm always looking for alternative treatments out there. If there is research out there going forward that is a good quality that shows that ivermectin works, I would certainly be open to reconsidering this as something that I would actively recommend. Overall, again, in the risk versus benefit question, risk seems quite low. Benefit, pretty questionable. Now, people also ask, what would I do? And as you may know, I am a high-risk individual. I did choose to get both doses of the vaccine and get boosted. But as you may know, since I had my pancreatic tumor removed, I am now left diabetic, although very well controlled with my blood sugar. And I no longer have a spleen, which makes it difficult for me to fight off secondary bacterial infections. Now, what would I do? If I got sick, I would start our immune protocol, our high-dose vitamin A right away. I've put that in show notes from previous videos that I've made. We have now moved it over to our Patreon page, our Patreon account. So if you wish to be a patron of this show, where you wish to show support for the type of work that we're putting forth, come join us over there. We have a lot of other exclusive data information there. Our education station, lots of my other primary care protocols are there as well. And of course, while we're putting the plug in, please subscribe to this video, to this channel, if you haven't already, and hit that notification button so you'll know when we put something new, since we're putting a couple videos out per week. Now, also, if my symptoms did start to escalate, what would I do? In all honesty, I would be quick to taking Paxlovid, which is the oral antiviral medication that became available several months ago, when back then it was kind of like a white whale, nobody could find it. But it has become much more available now. I just prescribed it for somebody a couple of days ago, and that's what I would do. Now, as somebody who advocates for medical choice, if a patient said to me, hey, I've weighed the risks versus and the benefits, I'm comfortable trying it, I wouldn't try to talk them out of it because I think it's a safe thing to do. But if they said to me, is that what I would do? Again, my answer would be no. So anyways, so that's the newest information that we have on ivermectin. I do want to point out that this is the same group that did show a clinical benefit using the Luvox, the fluvoxamine medication. So the fact that they were able to find that one repurposed medication did work and this one did not, I think that also lends some credence to the researchers themselves, because they weren't just naysaying, they were kind of looking for anything that could possibly work. And in Brazil, ivermectin is a much more accepted treatment than it is here. So they didn't receive the same type of scoring that doctors over here have used or patients have used. It was much more commonly seen. So there wasn't that kind of, could there have been a bias because of that? It doesn't appear to be, because it was something in there. But the reality is, at least in this study, it didn't work. So anyways, I hope that they gave you more information, gave you something to think about. Please leave comments in the and down below if you wish to comment more about this. Of course, please keep it kind. We like to do that here around here too. And I hope you have a wonderful day. Bye-bye.